Well, good afternoon, everyone. My name is Jackie Thornton, and I'm a global health journalist working for The Lancet and the BMJ, and I will be chairing this afternoon's session. On behalf of the NCD Alliance and Viatris, I'd like to welcome you to today's virtual event titled Leveraging the Expertise of Optimised Multidisciplinary Teams to Turn the Tide on the Intersection of COVID-19, Non-Communicable Diseases and the Health Workforce. Later, we'll be hearing a panel of experts to discuss the complex interplay of healthcare workforce shortages, NCDs and COVID-19. And we will learn about their efforts in this important area. But we also want to hear from you, the audience. So I'd encourage you to use the Q&A function box and to ask questions, which the panel will be answering towards the end of our session. The meeting is being recorded and it will be posted on the NCD Alliance YouTube stream channel. So for those of you who cannot make the session live, they'll be able to watch it later on. So I want to move to the subject matter. Today's discussion is very timely for a number of reasons, and not least because of the announcement 2 weeks ago of the designation of 2021 as the International Year of Health and Care Workers by the World Health Assembly. The COVID-19 pandemic has disrupted life as we know it, putting health systems under some of the toughest strains we've ever seen in the 21st century, and highlighting existing shortages in the global health workforce. The WHO has come up with some staggering statistics, a shortfall of 5.9 million nurses in 2020, and projections of a staggering 18 million health workers for shortfall by 2030, just 10 years away. From the announcement of the first COVID case in December last year, health and care workers have been at the front lines. They've been fighting to safeguard lives, even at their own risk. They've been dealing with increased workload, high risk for contracting COVID-19, and the need for updated knowledge and skills, as well as fatigue and psychosocial stress. Thousands have lost their lives worldwide. That's a very, very sad statistic. But COVID-19 has also called global attention to another health crisis, and that's of non-communicable diseases. People living with NCDs are at a much higher risk of becoming severely ill or dying from the virus, and we are also likely to be experiencing obstacles to managing their conditions due to the disruptions in health systems. So this complex intersection of COVID-19, NCDs and the global workforce crisis can only be addressed through sustained, innovative and transformational efforts on health workforce capability. So as I said earlier, we've got a panel of experts to discuss this and we'll learn about their efforts to turn the tide for good. But before I introduce today's panel, I would like to give the floor to Katie Dane, the Chief Executive Officer of the Ntd Alliance, to give her opening remarks. So Katie, you have the floor.
Thanks very much, Jackie, and good morning, good afternoon, or good evening, everyone. My name is Katie Dane, CEO of the Ncd Alliance, and I'd like to echo Jackie's welcome to both our distinguished panel of experts, as well as for everyone joining as participants. And we're really looking forward to an interactive and dynamic discussion as much as we can on, on Zoom calls. So today we'll be discussing a very important aspect of the NCD response and of health systems globally, which is very much the optimization of our health workforce, especially those at the front line of care. And before going any further, I would also like to thank Viatris, formerly Pfizer Upjohn, for joining us as co-organisers for the event. As the world has confronted COVID-19 this year, the challenges related to the health workforce are as stark as ever. And Jackie's already painted a picture of some of the challenges that we've seen this year, particularly. The commitment of health workers engaged day by day as the front line of the COVID response and maintenance of essential health services has been truly heroic on a day-to-day basis. As we all know, the health workforce is very much central to the fulfillment of global and national NCD goals, and its strengthening is essential to the progressive attainment of universal health coverage. which is obviously a major focus and priority of global and national community alike. Nevertheless, it's very clear that there's a glaring care gap in the global NCD response that we at NCDA have witnessed over the last decade, driven very much by the perennial issues of health workforce shortages, skill mix imbalances, barriers to establishment of multidisciplinary teams, inefficient use of resources, poor working conditions, and limited availability of data, which is so essential on the health workforce. In September 2019, we released a report entitled "Protecting Populations, Preserving Futures, Optimizing the Health Workforce to Combat NCDs and Achieve Universal Health Coverage," which was developed jointly with Pfizer Upjohn. And this report, for those that haven't had a chance to look at it, really highlights the crucial role of the health workforce for NCD prevention and control across the whole continuum of care, and presented strategies to support the planning, the education, deployment, and management and reward of the health workforce for NCDs, particularly at the primary care level, which is so important from an NCD perspective in terms of early diagnosis, treatment, and management of these chronic conditions. Building on its findings and its recommendations, since then, we have been working closely in collaboration with national NCD alliances in Japan, Malaysia, and in Egypt to address the challenges that we highlighted in the report in terms of an effective health workforce for NCDs and to promote best practices in these geographies. The COVID pandemic has really put a spotlight on all of the long-standing cracks in our global health system. Health systems are creaking around the world because of this pandemic. But in particular, it's also highlighted the fact that our health workforce has been severely neglected, which puts, as Jackie said, the health of people everywhere at risk, including people living with NCDs. Yet through COVID-19, we've also seen how heavily we in our health systems depend on health workers, making it terribly clear that there's an urgent need to strengthen, optimize, and invest in health workforce globally, drawing on the lessons from the pandemic, in particular drawing in the perspective of those people who have been on the front line of the response. WHO's 2020 International Year of the Nurse has really taken on a whole added meaning this year. And so too will next year's International Year of Health and Care Workers, as governments and stakeholders everywhere seek to build back better from the COVID pandemic and really learn the lessons that have become very clear over the course of this year. So we're really delighted to be convening this webinar on this topic. Our discussions today will really hone in on the challenges and the solutions for optimizing allocation of human resources for health in both the context of COVID and NCDs, which are very much being seen as a syndemic around the world. Also, over the course of the next 90 minutes, we'll be showcasing relevant approaches and strategies that can be replicated on a larger scale and in a variety of contexts, including innovative care initiatives aiming to leverage joint expertise of multidisciplinary care teams through digital health solutions. One solution that the Ncd Alliance is particularly excited about is the Ntd Academy, which was launched by our partner, the American College of Cardiology, in collaboration with ourselves and the World Heart Federation and supported by Vitris. The Ncd Academy is really the first of its kind collaboration between major actors in global health to equip frontline health workers like nurses and clinicians with integrated mobile education on NCD care. And we believe that this will be crucial as frontline health workers take on a more prominent role in both the treatment and prevention of NCDs. And that this type of initiative is particularly important for the management of NCDs, as evidence demonstrates optimal allocation of human resources for health can address some of the bottlenecks, such as fragmentation and barriers to care, as well as maximizing benefits for service users and foster stronger health systems in the long term. So in summary, if we are really to achieve the Sustainable Development Goals in the era of this very challenging COVID-19 pandemic, it's become more important than ever to support the building of knowledge, skills and motivation amongst the health workforce as a means to really improve population and global health outcomes. And now is very much the moment to be putting forward an urgent call to action for all stakeholders to prioritise the need for an optimised health workforce for NCDs and all health issues. So with that, I'll hand back to Jackie to steer us through our expert panel of speakers. Back to you, Jackie.
Thanks, Katie. And I think some important points there that Katie made about these care gaps and about the limited data that we have, but how digital collaboration and general collaboration in exciting developments such as the Ncd Academy are moving things forward. And I thought also impactful that you talked about rewards for healthcare staff in terms of encouraging them to work on this NCDs in primary care and investing generally in healthcare workers. So it gives us a lot of pause for thought there. So thank you, Katie. So we have a number of panelists today and I'm delighted to welcome them to the event. We're going to be going around to ask each of them a question and they'll answer it in full. And we'll do that a couple of rounds and then we'll have time for our discussion. And just to say that there will be an physical activity break between the questions of the panelists and the Q&A to make sure that we're all keeping fit and active and healthy and not sitting on our chairs for too long. So first of all, I would like to introduce Dr. Catherine Duggan. Dr. Duggan is Chief Executive Officer of the International Pharmaceutical Federation, the FIP, and also she is a member of the World Health Professionals Alliance. So I'm delighted to welcome Catherine to be our first panelist. Catherine, what are the biggest challenges for the health workforce before and during COVID-19? And how are these impacting the adoption of integrated, people-centred approach?
Thank you so much, Jackie. Really, really important questions. And I must say thank you to you and Katie for the context around this today. I'm Chief Exec, as you've mentioned, at FIP. We're an organisation that represents around 4 million pharmacists and pharmaceutical scientists. Based in The Hague, we were founded in 1912. The World Health Professions Alliance speaks for about 34 million healthcare professionals worldwide. And it was formed in 1999 and pulls together the world's dentists, nurses, pharmacists, physical therapists and physicians. So hopefully some of the comments that I'll be making today really reflect some of the thinking that we've been doing as an alliance. And obviously I'm a pharmacist myself and I've seen some of the frontline impacts as well. So Jackie, you said the question was, what is the biggest challenges for health workforce before and during? The challenges of the health workforce primarily relate to many factors. One are around continuous educational needs. And if we address this issue alongside other priorities, which I can outline, we believe we can foster the adoption of integrated people-centred approaches and creation of true multidisciplinary teams. Some of the priorities that have just emerged or been highlighted or spotlighted, I think, during the COVID pandemic. Understaffing. Even before the pandemic, we knew we were facing an 18 million shortfall in health workforce by 2030. Workforce shortages already lead to fatigue and burnout, as we all know. We all need adequate breaks between our shifts and time off. And we know psychological pressures are further enhanced by not having adequate breaks. These have all been amplified since the pandemic started in March and are worsening as we continue through the different phases. And our health workers are also charged with the catch up on activities that had been put on pause during the first waves across all our societies. Other things that can impact all of this include changing guidelines and a lack of clear information, perhaps even changing policies. And, you know, we're all faced with being asked questions by our patients and our colleagues and our staff. And this can always be stressful, made more so, we would argue, in the COVID pandemic. Another point is not always being consulted on the process adds pressure. If you're leading a department or you're leading a pharmacy or a dental practice or your own GP practice, or you're in a physical therapist environment, not always being consulted can add pressure. We've seen a lot of exclusion out of consultations, or perhaps even whole professions being excluded or forced to close their doors. And we need to include the experience and leadership skills of all our health professionals who can really advise and take ownership over their part to play. Advice based on their observations from the front line are invaluable. And if you think about containing the virus, we've got lots to learn from professionals who have perhaps gained experience in other countries or even during previous epidemics. Well, you mentioned about the death of health professionals, and we've tried to obtain data on health professionals who have died in connection with COVID-19 in the WHPA, and data on those who have fallen ill or become infected. And we found it super difficult. It's extremely difficult to obtain such information. And when you do, you don't know how accurate it is or how specific it is. It has either not been collected or it's been gathered inconsistently without comparable methodologies. Despite this incomplete data set, it's too apparent to us that worldwide mortality and morbidity rates amongst health professionals are incredibly high in the current climate. Each of the Alliance members has sought to gather such data for our own professions. And it's really interesting to see how the patterns are further exacerbated by health professionals who may also be suffering with NCDs or having other comorbidities, perhaps from different ethnic minorities, or if you think about different socioeconomic status. And this is different in each country, but also markedly different in each of our professions. As you see them stepping up and standing up to deliver healthcare for all in the pandemic, it's increasingly apparent that by doing so, they have put themselves at more risk. Longer term, we recognise the need for investment in emergency preparedness and to look into the vulnerability of supply chains, not just of the PPE we all need, but also of medicines. And now we see the supply chain challenges that will face us with vaccines. WHPA has directly asked governments to ensure decent working conditions, including occupational safety, manageable workloads, stress reduction measures, adequate remuneration, provision of psychosocial support and counselling, some of the things that our healthcare professionals have seen and been witness to, but also under increasingly difficult situations in PPE themselves, has really warranted the need for some counselling. And it's important for us to take this learning into the next set of emergencies that we face. As an interprofessional alliance, the WHPA is committed to improving the health of populations worldwide through efficient, effective and equitable delivery of preventative, curative, rehabilitative and palliative services. This really is something that the Alliance has always been supportive of, but can really see the strengths of the Alliance in behind this now. We know our healthcare professionals strive to deliver high quality services within their scope of practice, and wherever they're based, whether it's on the front line in the community or whether it's within the hospital setting or in a private practice. There's some respect for the expertise of other members of the team that we need to just take a pause and a moment to encourage. For many individuals accessing health services, we know that there may appear to be duplication, gaps and discontinuity as they progress through the health system. And it's a challenge that health professions can address positively together and with other agencies. We need to do better in making the healthcare journey of our patients more efficient and effective. We've got some resources on our website, the whpa.org website, around our statements on interprofessional practice, if anyone would find that of use. And I'd be happy to expand on that later in the session. Thank you so much, Jackie, for offering me the first podium. I look forward to hearing the other speakers and their comments.
Thanks very much for that, Catherine. A very in-depth answer, and I thought it was interesting to hear that these universal problems of not being able to take enough breaks during the pandemic, not being able to continue with education, not having enough data to know what the real statistics are on mortality, and the need for counselling for people who need to be supported during these really difficult times. So thanks very much indeed for that. I want to turn to our next panellist, and I'm delighted to welcome Professor Adele El Syed Salim, who's the president of the Egyptian NCD Alliance and also president of the Upper Egypt Diabetes Association, UEDA. Thank you very much indeed for joining us today, Professor. What would you say are the main barriers to strengthening the healthcare workforce for NCDs and for universal healthcare in your country?
Thank you very much indeed for having me in this important session. I'm sorry I'm a little unwell, so I'm trying to be just concise. Actually, there are important lessons we all learned as NCD healthcare providers and NCD interested non-professional individuals. We all know now that there had been a huge disruption in the NCD care service during the COVID-19 pandemic. The WHO survey during last May, they did a survey among slightly less than 200 ministers of health, and they discovered that the overwhelming majority of the responders stated that the delivery of healthcare to NCD, people living with NCD, was disrupted because of COVID-19. And that disruption had been always proportionate to the degree of transmission of the infection. When the infection was just sporadic transmission, the disruption was less and increased when it transformed to cluster infection. Then when it became community infection, the disruption was very, very severe. So that had been an important lesson we all learned actually. And having that in mind, we have to have an in-advance integration of the NCD care into the pandemic-facing plan regarding the healthcare system, which has to be proactive and should never wait until the people with NCDs deteriorate because of the NCD care disruption. Definition of the role of nursing is very important, actually. I'm just finishing a webinar with the WHO and the IDF together with the International Council of Nursing to discuss the role of nursing in our area, in our region, and in my country, in Egypt. So we have to define the role of nursing in these circumstances, because we have got a huge shortage of the number of nurses, and the estimates are, the WHO estimates actually, are that we have to increase the number of nurses by 8% every year for 10 years until we achieve the target number of nurses in the healthcare. And meanwhile, we have to check for the quality of the nurses. So these are very important issues, because the shortage in nurses, number in quality and quantity, is basically concentrated in the low and middle income countries, where my country is one of them, and most of the countries in my region are part of that, actually. The third issue is the wide adoption of the use of online consultation. This is an important issue during, caring for the patient with NCD during the era of the COVID-19, and well, now meetings are done online. We are doing this meeting online, so we have to think about online consultations during these areas. Of course, there are some gaps regarding online consultations, medical consultations, regarding ethical issues, legal issues, and convenience from the side of the patients. These issues had to be sorted out. Then the education is very important. We have to educate actually the people living with NCD how to look after themselves in these areas when sometimes the medical service is not available and easy to obtain. Regarding my country, you asked about my country. Actually, we have just finished a huge initiative called the 100 Well-Being Initiative. It was originally planned to eradicate hepatitis C virus. You know that Egypt had been the highest prevalence of hepatitis C virus in the whole world. And that initiative was done just to screen for hepatitis C virus and treat them all together. So it's a huge project. I think it might be the hugest over the history because they screened 50 million individuals over the last couple of years. And they integrated with this screening to screen for NCDs. So they screened for diabetes, for obesity, for hypertension. They measured blood glucose, body mass index, and they measured the blood pressure. So they screened for NCDs in addition to screening for a viral disease. So if we have that in mind, we know that there is another initiative starting now in Egypt called the Presidential Campaign to Treat Chronic Diseases. This is the name of the campaign. So with the huge experience which was obtained during the last initiative, now it's rather easy for the healthcare professionals who worked in the previous initiative to adopt the same thing, because it's basically the same. The last one was a viral disease, and then on top we screened and treat NCDs. Here's another viral disease, which is COVID-19, and on top we can then screen for and treat non-communicable disease or NCDs. So that's sort of showcase regarding the situation of Egypt. We have. Sorry about that. We have some projects here in Egypt, which is carried out by the Egyptian NCD Alliance, which I'm chairing right now, in collaboration with the Global NCD Alliance and the Viatris company. They are helping us very much regarding that. We have a project in about educating primary healthcare professionals. We started it by having a course, an NCD course for the primary healthcare physicians, and we are planning now to involve the nurses and diabetes and NCD health educators as a second step in that project.
Thank you, Professor. I think that's a
I'm sorry. I exceeded my time. I'm very sorry about that.
Not at all. That was a wonderful overview, and I'm very delighted that you have joined us. Given that I know that you're not feeling very well, and if you could join us for the next round as well, that would be fantastic. So thank you very much indeed for that, Professor.
Thank you.
Just to recap, obviously, Professor Adele is talking about the need for proactive action and that don't wait until NCDs deteriorate in these trying times, and also importance of the lack of nurses in certain low and middle income countries, saying that we need maybe an increase of 8% for every year for the next 10 years to get the number of nurses that are needed. So a very important point, but also they need to be a good quality nurses, and nurses are well educated and well trained. And obviously he noted some important initiatives there happening in Egypt, the Wellbeing Initiative, the 100 Wellbeing Initiative, which started off as hepatitis C, and the presidential campaign. So thank you very much indeed for those points.
Thank you.
I want to move on now to talk about how the private sector can become involved. And I want to introduce Dr. Lobna Salem, who is the Regional Chief Medical Officer, Developed Markets, which is North America, Europe, Japan, Australia and New Zealand, from Viatris. So very pleased to introduce you here, Lobna. And I want to ask you, apart from ensuring that timely development of innovative medicines, vaccines and diagnostics to safeguard the health and well-being of populations, like we've seen for the COVID-19 pandemic, Viatris continues to convene forums to bring attention to the global health workforce crisis, I understand. So why are the challenges of the health workforce important to the private sector? How is the private sector contributing to a better trained and more efficient health workforce? And maybe you could give us some examples of what Viatris is doing, please.
Thank you so much, Jackie. And can you hear me well?
Yes, we can. Thank you.
Thank you. I'm so honored to be joined by my fellow panelists, such an esteemed panel. And thank you for the NCD Alliance for co-hosting this event and for our partnership for many, many years. For many years, we have partnered with the NCD Alliance on really combating the burden of NCD. And as Katie mentioned in her opening remarks, as well as Dr. Adele, actually, we we started our efforts as Pfizer Upjohn, and then we actually we made relieving the burden of NCD our primary objective and our primary mission. Now that Upjohn has combined with Mylan to form Viatris. Actually, this is our second week in Viatris. So I'm very happy to say that this is our first event, our first public event with Viatris and NCD Alliance. So that kind of highlights how important NCD is and will remain a priority for Viatris. Just a little bit of background on what we stand for. I mean, definitely Viatris is proud to continue supporting the NCD Alliance, the work of NCD Alliance, and the work of the primary care health workers. Just to, in order for everybody to remember what Viatris is it's a Latin for via, through, tris is three, it's access, leadership, and partnership, and that is all. I mean, it really says that, how we want definitely to access medicines for our patients, leveraging our global footprint, our leadership in NCD and others. We have also a very rich portfolio in communicable, in infectious disease, as well as partnership like this one and others. Just before I talk about the examples and what we've done as private sector, I just want to say one statement is that no one can do this alone. As we all know and we've heard, it's the NCD problem or the NCD burden is so complex, and the primary healthcare workers at the forefront of it. Whether you're talking about the fragmentation of care, the lack of integration of care, some of the resource constraint that faces the primary care health workers. So it's not something that a sector can do it alone. We have to collaborate as civil society organization, governments, multilateral organizations, healthcare professionals, academia. Really, we have a shared interest to combat this, this global burden, and we need to act in unison. And I want to draw one parallel. Yesterday, actually, we commemorate the World Day of AIDS, and those of you who are old as me would know that we started this back in 1988. And at the time, it was like HIV was, sentence of death. Actually, now HIV, I proudly say, it's a chronic disease. It has evolved to be a chronic disease. But we should look actually into the HIV movement as a case study for how NCD intervention, patient fear and anger led this to intersectoral involvement using non-conventional methods. HIV now, at the time, became a priority, a global priority that rallied a global agenda behind it. And this is very important. So it really, what the NCD movement needs is, it needs the same groundswell of resolute stakeholders to really striking the problem at all angles. If we go back to the primary care health workers, there are a lot of things. I mean, education is part of it. We have, healthcare infrastructure is part of it. Lack of resources is another part of it. I think the two major things that I can mention I can mention many things, but the two major things I want to highlight are collaboration with the NCD Alliance on the report on the role of the primary care health workers in combating the burden of NCD. And we have a lot of findings out of this report. And these findings we're leveraging in multiple countries under the leadership of the Global NCD Alliance, where they're really helping the local NCD Alliance, as we're talking about Egypt and other countries, as Katie also mentioned. We're looking into what are the needs, what are the specific needs in those countries. Again, it's a complex problem, but the solution not one size fits all. So there's a needs assessment ongoing in a lot of these countries to understand what are the needs that, if fulfilled, would move the needle, because there's a lot of needs. But what are the needs that, if fulfilled, would move the needle towards the solution? So we're working very closely with the NCD Alliance on that. Another very important aspect, which talking about also digital technology, is the NCD Academy that Katie has mentioned as well. NCD Academy actually is a way to educate primary care health workers on combating NCD. Historically, as we said, there are two gaps here: care gap and data gap. Historically, people learn, the way we learned in medical school is that, the risk factors for a disease and all that, it's all very good. But the NCD problem is so complex. Nobody gets a cardiovascular disease alone. Nobody gets a diabetes. It's actually integrated. So it needs really the education of the primary care health workers to understand about the comorbidity among all these kind of interlinked diseases that comprises the NCD. So actually this is, a mobile, it's free, it's CME accredited, it's translated to many languages across the globe. We're definitely a founding partner with American College of Cardiology, NCD Alliance, World Heart Federation. And the beauty about this platform, it partners also with the local societies. So, there's a lot of uptake by the countries where the local societies also get engaged and are able really to contribute and really to find the benefit from this platform. So I believe these are the two, working on the report that led to outcomes, and these outcomes are being implemented. And the second thing, building an education platform for the primary care health workers to educate them on not only the disease-related, but also the non-disease related aspects of non-communicable diseases. And we're going to add more. Now we started with cardiovascular. We also had a COVID chapter under the leadership of the NCD Alliance. We're partnering with ASCO also for the oncology chapter, with the American Diabetes Association, with a lot of other reputable societies in order to deliver on the education needs for the primary care health workers. These are the two major examples, and maybe in the Q&A I can elaborate on other examples as well. Thank you so much, Jackie.
Thank you very much indeed, Loma. Yeah, great overview on what the private sector can work with the other sectors to actually advance good care in NCDs. What I took was a key message there that we should look at how the HIV has worked out in terms of the groundswell of opinion to change and move healthcare in HIV. Also, how we need resolute stakeholders to push things forward, and that one size doesn't fit all in this arena. And also the emphasis on the education of primary care workers and the advances made with the NCD Academy. And you're right, we will be coming back to that in the Q&A, because I would like to hear some more tangible examples of how that is actually working in practice. So I want to move now to introduce Melina Mehta, who is the Global Health Philanthropy Portfolio Lead at the Medtronic Foundation, who is based in Washington, DC. Obviously also private, coming from a private background. But I want to ask you, Melina, we've seen from the global HIV response, as has been mentioned by Lobna, that the mobilisation of community health workers can be a useful lever for health workforce capacity strengthening. Can you please discuss the role that community healthcare workers have played in supporting the provision of regular care to underserved populations, especially those living with NCDs who are at the highest risk for COVID-19?
Yeah, thank you so much, Jackie, and to the NCD Alliance and Beatrice for having me today. Great to be here with you all. So the Medtronic Foundation partners to improve health for underserved populations, as well as supports communities where Medtronic employees live and give. We believe that the impact should be measured by more than just the dollars we give, and we strive to bring both money and expertise to our partnerships. And we do this in a variety of ways. This is through improving health outcomes for underserved populations in Medtronic disease states, so cardiovascular disease, diabetes, by putting people in the need at the center of their care, supporting health workers and strengthening health systems to scale and sustain health improvements, and by also empowering Medtronic employees to positively impact local communities by leveraging their skills, time, and resources. You know, a lot of our work is focused on health workers and community health workers and frontline health workers. And we know that when they're well supported and valued as members of the healthcare delivery team, they play a pivotal role in improving health outcomes for underserved populations. So through our previous global health programs and partnerships, we've seen this unique role that they play in supporting patients, families, peer groups, et cetera, to sort of educate, empower, and enable self-care in culturally appropriate ways. And we know that when community health workers ensure that individuals are linked to care and retained in care, that they get the time and attention needed to address their chronic conditions. So the foundation is really engaged in and invested in strengthening health worker capacity and providing them with the appropriate tools, advocating for supportive supervision and mentorship. And ultimately, we want health outcomes for these patients to be achieved. I think all of this sort of echoes Dr. Lubna's point about the need for integrated care. And I think particularly right now, we've seen how disparate NCD care is, and when it is sort of given it's very siloed and very vertical. And I think in light of COVID-19, this has been true across all of our partnerships. And so we're seeing this need for integration. And I think, you know, a lot of our partners have sort of figured out how to do this in the best way. And I think I'd like to probably highlight a couple of examples in the US where we have a really high burden of COVID-19, as you know. I'd say trust has been the cornerstone of connecting disenfranchised communities and patients to effective health service delivery. So in South Minneapolis, Minnesota, we have a partnership with an organization called People Center. It's a federally qualified health center that provides a variety of underserved, that serves a variety of underserved populations, including one of the world's largest Somali populations outside of East Africa. So their community health workers make regular home visits to build trusting relationships with their patients. This includes cooking classes, in-home blood pressure and blood sugar checks, wellness classes, exercise classes, et cetera. And then in combination with Medtronic employees, they've also brought mobile COVID-19 testing services to public housing buildings where many of these Somali refugees live. And this has helped, you know, sort of to identify and outbreaks before they end up taking hold. One of our other partners, the Sonoma County Center for Wellbeing in Northern California, conducted an ROI, return on investment analysis to understand the cost effectiveness of health workers in their programming. So in addition to demonstrating the necessity of health workers and their impact on populations such as the Latinx community, where it sort of has a stronghold in Northern California, we've seen that they can also help to combat misinformation that exists around COVID-19, and health workers are able to provide education on social distancing, virtual screenings, et cetera, et cetera. So I think to answer your question, Jackie, ultimately we've seen that community health workers really are the bridge between this fragmentation of trust and the delivery of quality and continued care. So no matter if it's COVID-19 testing, if it's chronic care services, and then I think ultimately we'll link to vaccine administration, which is going to be a big need for all of us, and particularly here in the US.
Thanks very much indeed, Mlima. Yeah, very interesting. Again, we heard obviously that when healthcare workers are, with community healthcare workers are well supported, they can play this really pivotal role in helping to support not just only the patients, but the families and peer groups, and encourage self-care. But also she noted that care is disparate, it's siloed and vertical, but she then gave us a couple of really good examples, particularly the South Minneapolis one, where the Somali community were being helped with community workers visiting at home and cooking classes, etc. So really good examples there of how well supported care workers are really making a difference and acting as this bridge of trust, as she said. Well, look, thanks very much indeed. We've come to the first round of our questions to our panel, and I now would like to do a second round of questions, and I'm going to have the same process but in a slightly different order, although I am going to start with Catherine Duggan again. Catherine, thanks for your comments earlier. I just want to talk to you now about how what you've been talking about, how can it be extended? I mean, the World Health Assembly, it designated 2020 as the International Year of the Nurse and the Midwife. And as I've already said, 2021 is the International Year of Health and Care Workers. What does this mean to the body of healthcare professionals globally? And how will the health workforce maximise this window of opportunity?
Thanks so much, Jackie. I'm really fascinated by the other presenters earlier on as well. Thank you to all of you. So, Jackie, we know that the Year of the Health and Care Workers will provide us with opportunity to showcase and share the work of our health professionals, and for us as an alliance, for WHPA to share some of our active campaigns with other health workers so the benefits are more widely felt. We really can see that by sharing good practice during these times, we really can make the biggest impact. So WHPA has ongoing campaigns on the need for positive practice environments and other key asks that we would like to bring to the table. Naming a year, as we have seen this year, the Year of the Nurse and the Midwife, shines a light on the crucial role and total dependence that we have on health professions and other healthcare workers. The COVID-19 pandemic has put unprecedented stress on health systems globally, as the other speakers have just clearly outlined, and yourself and Katie did at the start. And it's increased the need for productive, supported health professionals and other healthcare workers. There is a pressing need to invest in the health workforce. And it's not just monetarily, it's also with all the things that we spoke about before. Over the last year, we have been impressed to see health personnel finally being recognised for their value. However, in the wake of this recognition, there has been a glaring lack of action. Indeed, Her Royal Highness Princess Muna Al Hussein of Jordan, during her address at said World Health Assembly, concluded correctly that applause without action is no longer acceptable. And I think we can all appreciate that stance. The WHPA and all of our members will celebrate the Year of the Healthcare Worker by bringing forward our advocacy for those working in healthcare. To tackle the high attrition rate of health professionals worldwide, we need significant improvements on all levels and in most nations, actually, to strengthen health and healthcare by providing better recognition, better workplaces and better working conditions. We know that will impact the patients and the public that we all serve. So we recently launched our Positive Practice Environments campaign, which does that. It focuses on improving the workplace for all health personnel, contributing to making work in healthcare more attractive, more dignifying and more effective. We consider this campaign to be a really fortuitous building block to achieve the WHO's triple billion targets. Without a strong and highly qualified health workforce, we won't be able to achieve universal health coverage. We won't be able to protect people from health emergencies or have better overall health and well-being. Unfortunately, I would say the pandemic has further highlighted the very real need for this kind of campaign. Healthcare settings that support decent working conditions, attract and retain staff, provide quality patient care, make it a good environment for patients to receive care, to strive for excellence and strengthen the health sector as a whole. And the WHPA believes that empowering health professionals is an essential step to meet the ambitious targets required to achieve universal health coverage and meet the Sustainable Development Goals that you rightly outlined, Jackie. Health professionals are at the heart of every healthcare system, and our governments need to recognise this and provide safe and important, really supportive environments to help them thrive. And we've seen that, if we do this, we need to establish this throughout the health sector. It's not just for the healthcare professionals. So we would definitely seek to work in alliance with others to make sure that this is a national, international, cross all health and social care networks, so that we all can benefit from a positive practice environment. The campaign itself was endorsed by the International Hospital Federation. So we sought support from other organisations. And as I mentioned, it aims to improve quality of healthcare workplaces. Lots and lots of materials on our website if people want to go there. There's posters, fact sheets, evidence-based checklists, and campaign materials in English, French and Spanish. And we see very much the opportunity for collaboration, building on good practice and learning from each other as a really positive step forward. When we had our launch of this campaign, I actually said, I would suggest that a positive practice environment investment delivers you a positive people experience. And that's what we should do as employers and as health professionals who are in positions of leadership, make sure our health professionals are supported to deliver for patients in the public. Excellent healthcare professionals are the best buy for healthcare for people. And I stand by those words. And I would say that's really the lasting legacy that we can offer here today. I look forward to further discussions. Thank you so much, Jackie.
Thank you very much indeed, Catherine, for that. And as you say, it's really important to improve those workplaces, make sure that they are supportive environments for people to do the best they possibly can for their patients dealing with NCDs. Now, I know that Professor Adele was unwell earlier on. He may or may not. Yes, he is back with us. Excellent. That's great. So if I bring in Professor Adele again, thank you very much. So yes, I wanted to ask you, in terms of civil society, how could barriers and opportunities around the world, around the health workforce, be addressed by civil society in collaboration with people living with NCDs and healthcare professionals?
Thank you very much. I touched the issue of the nursing healthcare professionals right now because I'm just freshly coming from a webinar between. Actually, it's an agreement. We are trying to do an agreement between the WHO, the EMRO office of the WHO, the East Mediterranean Regional Office of the WHO, and the MENA region of the IDF, the Middle East and North Africa region of the International Diabetes Federation. And this is geographically the same, it's just different names. And the third partner is the International Council of Nursing, the ICN. These are the three organizations which had a meeting early today, and had to share it. We spoke about the global nursing workforce is it's about 28 million nurses, and the deficiency is 6 million actually. Nurses forms 60% of the medical healthcare professionals, and we have a great deficiency over there. So the agreement which we are planning, this is a showcase in the whole region and in my country, in Egypt in particular. Actually, I spoke about the way to go, how to do that, how to improve the case of the MENA region. I suggested that. My suggestions were forming a committee from the three organizations I just mentioned, just to sit down and think how to implement the initiative regarding that. Number one, by studying the best practices in nursing in the world. Then we plan to do an assessment of the nursing situation in the region through a group of surveys, including different stakeholders, nurses, physicians, healthcare policymakers, and the public as well. These surveys should be designed to identify the gaps and the challenges which are needed to overcome. And we will choose a number of countries inside the region, taking care of the discrepancy between. We have some of the richest countries in the world and others from the poorest side. So there's a big discrepancy, and that has to be taken in consideration, because the actions here, the actions needed, we have to design what actions we need to act just to face the challenges and to cover the gaps in the form of education and training, of course. And these actions will not be equal, of course, between all the region. Finally, we shall have a document which will cover the best case scenarios in different societies, different communities. And I believe this document will be beneficial not only for the countries of our region, but to communities elsewhere. So it's important to give, because usually actually we focus on physicians, primary healthcare physicians in particular. We are focusing on them through the last period, but now it's with the shortage of healthcare professionals, with the value of the nursing, we have to focus in the coming period on the nursing part of the healthcare professionals, just to do their job. And I'm pretty sure that in these difficult times of COVID and maybe the expected other pandemics, which are expected to come during the coming future, all scientists actually, expecting some other viral infections again. So we have to be pre-planned. We have to be proactive. We have to prepare ourselves just to face that by empowering and educating and training different parts of the healthcare professionals just to be able to face the coming problem. Thank you very much.
Thank you, Professor. That's fantastic for those comments. So I want to come now to Dr. Salem to talk about transforming the capacity of healthcare workforce. Lobna, COVID-19, it's demonstrated that we need to find innovative and transformative ways to enhance the capacity. Going forward, we should consider the potential of upscaling the use of digital technologies to pursue optimal levels of care. In what areas of NCD management can digital tools be deployed, do you think, to improve outcomes for populations? Which are the best ways forward?
You mean that? Sorry, Lubna, go ahead.
No, please, Dr. Adel, please go ahead. Please.
No. Go ahead, please. I
think they have similar surnames. Maybe I'm making the pronunciation wrong, but Lobna, if you could perhaps...
Dr. Adel is definitely
I heard it as Selim, because this is my last name, actually, Selim. So I heard it as Selim. I'm sorry.
Yes, no, my apologies. Lobna, if you want to go ahead.
Thank you, Dr. Adel. Thank you, Jackie. So there are multiple ways, digital innovation, and the lack of usage of digital innovation actually has hindered even the integration of care. So there are multiple avenues, but as I said, there are multiple ways to implement the digital solutions. There is, the telehealth. We've seen in COVID-19, for example, if there's any silver lining from the COVID-19 is that, as we all said, it blurred the lines between communicable and non-communicable disease to a more fundamental problem of the healthcare infrastructure. So that's one, but also it kind of forced us as a healthcare community in general to go to technology, because to go to digital technology and to utilize it, because that was our only way out, right? So there is the telemedicine, there is also as I mentioned, the education platforms like the Ncd Academy. There is also a big chunk of what the private sector and others need to really delve into, and together with regulators, is the AI and the big data, which is actually something that will really solve the data gap that NCD in general have. So I think there are many ways that in technology that we can help in, I'm talking we as a community, healthcare community in general, in combating the burden of NCD. If we speak specifically about the education piece, and back to, kind of go back to the Ncd Academy piece, reaching, the Ncd Academy platform in a nutshell, it's more if it's free, it's downloadable from everywhere. You can have it on your iPhone, you can have it on your desktop. It's for primary care physician, it's accredited. And the good thing about it is that it recognizes the fact that NCD is beyond diseases. For example, as I said, the NCD advocacy, there's a chapter that's going to be on the NCD advocacy, introduction to multilateral shaping to policy agenda. This is something that we're hoping to have in the NCD Academy as well, just to make, to explain to the healthcare community and primary health physicians, it's beyond disease management. Also partnering with key societies, as I mentioned before, like the ASCO, American Diabetes Association, just to partner because they have the scientific expertise in a particular disease that can help us do that. Another, so this is the NCD Academy, is translated in many languages. We have a lot of uptake from Latin America, from Asia, from the Middle East, from Europe. Actually, a lot of local partners have come up and asked to be part of it, and we are definitely, these are, we call contributing partners, where they're able to really leverage it internally. So I think the education piece, efforts on the education piece, maybe we want to avoid to have these efforts diluted. So we want to really focus from an NCD Academy perspective to kind of focus our efforts there. But it's going to be, our objectives really to be like, I don't want to say the one-stop shop, but it's more of, it's the place where people can go and really get all the knowledge they need about NCD, plus in collaboration with, initiatives, local initiatives like Dr. Adele has mentioned, because this all kind of doves nicely into a continuum of knowledge for the primary care physician. Another piece that we would want to really delve into is the real world evidence, where, as we said, there's a data gap where you have a siloed information related to diseases. So I think the real world evidence will play a critical role in understanding more of the NCD and ways to combat it along the patient journey and throughout the continuum of care. And we find more and more regulators, including the FDA, are recognizing the value of the real world evidence, given the complexity of and the expense of the controlled clinical trials. But all definitely real world evidence, at least at that stage, will always be used as a secondary resource versus the primary resource of a clinical trial. But again, it's a good way out to bridge the data gap that we can see in the NCD. Hope I answered your question, Jackie. Do you think there are other aspects?
Thank you. No, that's fine. And I'm going to come back in the Q&A for a question on the NCD Academy. So hold those thoughts. That's great. Thank you, Lobna. We've also got time for one more panel question. Before I ask that, I just want to say, please do send in your questions, everyone. We've had some comments on the chat, but if you could send in some questions for the panelists, is your one chance to talk to this esteemed number of experts on this important issue. So please do send in your questions. But let me turn to Mlima. Mlima, still reflecting on innovative and transformational solutions, I wonder if you could let us know how Medtronic Foundation is addressing health disparities through the creation of a learning community that leverages collective knowledge and deep expertise.
Yeah, thanks, Jackie. So the Medtronic Foundation Global Health Team built a learning community of all of our strategic partners to enable linkages across them, many of whom are seeking to provide the same provision of care across the globe. So from South Minneapolis to Puerto Rico, Nairobi to Bangalore. In addition to connecting with our partners individually on a biweekly basis, we convene all together every 2 months or so in a 2-hour webinar format where members share insights and best practices, they exchange their resources, and they discuss lessons learned across all of them. So we've covered a variety of topics so far, such as reducing health inequities across the populations we serve, effective self-management approaches, digital NCD tools, and other mechanisms, and also building business cases or calculating social returns on investment. And one of the biggest ways we've seen the learning community sort of take hold has been through the pivot of all of our programs in light of COVID-19. And I think this is particularly true because they had to sort of pivot to provide telemedicine services to their patients. So in Bangalore, we saw health workers are now providing remote services. So they have contactless medication delivery, NCD testing. They do e-gatherings in lieu of peer support groups, sort of where health coaches moderate virtual support groups and patients share their stories with each other, kind of like you would do in a normal peer support group. In Brazil, we've seen how effective mobile point of care checkpoints can be. So when they're manned by well-trained health workers, they can continue to combat NCDs, make sure patients are regularly tested and checked And then they also can provide COVID-19 screening and support. Other partners have taken to providing health workers with protected Google phone numbers so they can have, a safe line of communication with their communities. They've also provided WhatsApp platforms to keep patients engaged in the care pathway. Health workers have become counselors and they provide mental health support to their patients. So I think, to get at what, you're asking about the learning community, we realized that many of these groups and all our partnerships have sort of changed their interventions on their own. And what really wasn't until we kind of brought them together when we realized that all of these consistencies actually exist across our global partners. And so the learning community isn't necessarily intended to provide new ideas, but rather I think we've seen that it ends up validating innovations and ideas that partners have already had, and also helps end up making them better. And so I think we've seen that collective learning happens through regular insights from those on the ground. And I think by actively working to break down the funder recipient paradigm, we put the premium on partnerships, and we want to make sure that we never end up compromising patient-centered care. So.
Great. Thank you very much indeed, Nalima, for that, and some exciting initiatives there that I can really see why they're working and helping people throughout the world. Okay, so we've come to the end of our panel questions and answers, and I'm now going to have a 3-minute physical activity break so we can stretch ourselves and make sure that we're not sitting down too much. And I think we're going to have a video played for those 3 minutes while we're doing that. And then we'll be back for the Q&A where we can put some of your questions to the panel, and then we'll have a final wrap up at the end, and we'll be finished by 4 o'clock Central European time. So I think if the video is going to be played now, and then we'll join you in 3 minutes. Thanks very much.
ทุกคนในที่นี้นั่งนานเกินไปหรือเปล่าถ้าอย่างนั้นผมจะมาแนะนำวิธียืดเหยียดกล้ามเนื้อทั้ง11ท่าให้11ท่ายืดเหยียดป้องกันโรคออฟฟิศซินโดรมท่าที่1นั่งหลังตรงก้มหน้าเงยหน้าช้าๆจากนั้นก็เอียงศีรษะไปทางซ้ายและขวาช้าๆท่าที่2เอามือประสานหลังศีรษะดันศีรษะต้านแรงมือแล้วเปลี่ยนมาเป็นด้านหน้าบ้างท่าที่3วางฝ่ามือไว้ที่โหนกแก้มออกแรงดันโหนกแก้มต้านฝ่ามือและทำสลับข้างกันท่าที่4นำมือมาแตะไหล่และหมุนหัวไหล่มาด้านหน้าช้าๆพยายามให้ข้อศอกทั้งสองด้านชนกันท่าที่5นั่งหลังตรงและแอนอกให้ได้มากที่สุดท่าที่6นั่งหลังตรงบิดตัวไปทางซ้ายและใช้มือจับเก้าอี้ด้านซ้ายสลับบิดตัวไปทางขวาใช้มือจับเก้าอี้ด้านขวาท่าที่7นั่งหลังตรงยกเข่าขึ้นด้านหน้าใช้มือทั้งสองโอบไว้ใต้หัวเข่าและออกแรงดึงเข้าหาตัวให้มากที่สุดท่าที่8ค่อยๆเตะขาขึ้นลงสลับซ้ายขวาช้าๆแล้วค่อยๆเพิ่มความเร็วขึ้นท่าที่9เหยียดขาทั้งสองข้างไปด้านหน้าและกดปลายเท้าขึ้นลงสลับซ้ายขวาช้าๆแล้วค่อยเพิ่มความเร็วขึ้นท่าที่10วางส้นเท้าติดพื้นและกระดกปลายเท้าขึ้นลงและสลับเป็นยกส้นเท้าทั้งสองข้างขึ้นลงท่าที่11ยกขาทั้งสองข้างเหยียดตรงไปด้านหน้าค่อยๆหมุนข้อเท้าวนตามเข็มและทวนเข็มนาฬิกาและทุกท่าควรทำต่อเนื่องกันครั้งละ10นาทีสะสมให้ได้วันละ30นาทีและใน1สัปดาห์ต้องให้ได้150นาทีเพื่อตัวคุณเองโอเค
Okay, everyone, well, welcome back. And I hope that you enjoyed that little active session. And I hope that you're ready for some questions. So welcome to all of the panel. I think I have Nalima with me, Lobna's with me, Professor Syed with me, and Catherine Duggan. So thank you for staying with us. We have a question in from the audience, which is, does the planned global vaccination for COVID-19 offer us an opportunity to find, diagnose and signpost treatment for NCDs and a new supply chain which can be established for chronic treatments? So that's a good question there. You know, we've had the announcement today in the UK that this the Pfizer vaccine has been approved, and I'm sure that there'll be approval in countries throughout the world ongoing. Will this be an opportunity to find, diagnose and signpost treatment? Let me come to Catherine. I started with you each time, so I'm going to come back to ask you. What do you think? Do you think this is an opportunity?
I think what we're seeing, actually, Jackie, throughout the whole of this pandemic is opportunities for each of us in our healthcare professional roles to really use a moment where we can talk to patients and their families about whatever questions they have, to make some links for them. And as we've seen, the COVID pandemic has had really the worst outcomes in patients who are older, who have comorbidities, and who have perhaps pre-existing conditions, but also who come from different ethnic minorities. So it's a really big opportunity here to use those conversations and to use opportunities to interact with patients and their families to really promote the effective and optimal use of NCDs. And I also think that there's a really big opportunity to describe the benefits of vaccination, not just for COVID, but for other conditions in patient populations who have NCDs. Making those overt links, Jackie, is really going to be important for patients and the public. And we also know, I know this from FIP, that the pandemic's given patients and the public an opportunity to engage with pharmacists a bit more on the front line, where the pharmacists have the opportunity to interact, to talk about other things that are going on as well. And perhaps the repurposing of existing drugs that have been tested for COVID has opened opportunities for pharmacists to describe and discuss how NCDs can effectively be used in therapeutics. So very, very good opportunities here. We need to capitalise on it. And the COVID gives us that little bit of a, what I would call like it shines an emergency light on opportunities such as this.
Thanks for that, Catherine. If anyone else from the panel wants to come in, please do to raise your hand or let me know. But I want to introduce Bryson, who's coming to talk from the Ntd Academy from the Alliance. Bryson, would you like to unmute yourself and introduce yourself to everyone?
Sure, can you hear me okay?
That's right, yeah, great, thank you.
Hi everyone, it's a pleasure to be with you today. I am at the American College of Cardiology, where I serve as our head of global programs, and the focus of the majority of my time is definitely this Ncd Academy program that we launched earlier this year in partnership with Ncd Alliance as well as Beatrice. So happy to provide a bit more background. I'm sure Logan has already spoken in some depth about what Ncd Academy is, but I'm happy to provide more background and answer any questions from the panel or the audience.
Sure, thank you for that, Bryson. I think that the one question that I have for you is really how are we going to measure the impact from the Ntd Academy, and how can it be used across very different healthcare systems with different financial setups and access to resources?
Sure, I'll answer your second question first, because I think it's a little bit, we actually have kind of solutions in mind for that. So the inherently Ncd Academy is meant to be accessible in low resource environments, in countries and communities that have lacked access to traditional continuing medical education, or the fact that it's available via mobile. You can download courses when you have access to the internet and then complete them later. You know, maybe at home where you don't have access to the internet. You know, this standard, there's sort of a standard set of content for all of these courses that is looking at commonalities across guidelines for treatment of cardiovascular disease, cancer, whatever the topic of the course is. But then we are trying to build in kind of supplemental materials. It talks about how the course relates to the context of, say, Brazil or Saudi Arabia, a specific country. And then also additional content that talks about how the course relates to, you know, a community health worker or a nurse rather than a physician. We have been producing videos with experts from around the world to talk about application in the country context. And we hope to do the same thing with experts in fields besides, you know, who are in other roles besides GPs as in the primary care team to talk about the application for nurses or pharmacists or other members of that group.
Okay, thanks, Bryson. Let me bring in Lobna, because I think Lobna might have something to say about the impact and measuring the impact too.
Absolutely, and thank you so much, Bryson, for joining. And as Bryson alluded to, it's the NCD Academy is available for all types of setting. And just to add is that we're not only focusing on disease-related topics that actually is tailored according to the guidelines by countries, but also we're looking into general topics from an NCD healthcare system perspective. For example, we found out that in more of the developed economies, for example, healthy aging is the kind of the key for combating NCD burden, or lack of adherence in developed countries, more of lack of resources maybe in low middle income countries. So despite that NCD is the global phenomena, definitely each healthcare system tackles it differently, and the causes in different healthcare systems are definitely different. The way we measure impact and success, definitely wanted to make it available in many languages, and definitely Bryson knows all about that. But also we're measuring the uptake. So we're looking into how many countries are, kind of adopting the NCD Academy. What is the level of, physicians logging into the platform, and that's something that we're hoping that we started since we launched the platform. We're hoping also to improve on. And we have a good case example when we started with the ACC back in 5 years ago with a CV prevention global program. We were able to do similar intervention, and we were able to measure behavioral changes even with healthcare professional. We reached almost 75,000 healthcare professionals, almost 200 million patients. So we have precedent in measuring impact of such digital programs, and we'll definitely use this as a springboard to replicate in the NCD Academy as well.
Thank you very much, Lobna. Let me bring in Adele. Adele, how do you see this playing out in Egypt? Is this something that is already being used, or do you see it being developed further? Adele, that's it. You're on mute, Adele. Could you unmute yourself? That's it.
Okay. Can you hear me now?
Yes, we can. Thank you.
Okay, thank you. Actually, the NCD Academy is a fantastic sort of initiative. I went through the first part, which appeared first. I mean, the cardiology part. They started with the cardiology part, and then they are expanding the scope to other areas. It's really fantastic. What I feel is, well, the American College of Cardiology and the NCD Alliance, I did their job excellently by having that academy. Now it's our own role. I mean, the recipients of the NCD Academy and those who are responsible locally on the people living with NCDs. My feeling is we now have an excellent platform, which is the NCD Academy, and our coming initiative is to develop a model NCD care clinics. This is a new thing, actually. We don't have NCD clinics. We have specialized clinics here and there, but NCD clinics and the basic NCD clinics, our plan is now we are preparing. Actually, we finished preparation of the concept note and the steps of forming a model NCD care clinics. These clinics will start with the most remote and deprived area of a country like Egypt. I mean, we're starting from Egypt, of course, and we are starting with the most remote and deprived areas. And the people who will be responsible to run these clinics are two individuals, primary healthcare physician and primary healthcare nurse or health educators, NCD health educator. So these clinics will be run, supervised trained, educated centrally from here by using the online methods. Now the internet is available in everywhere, in every corner, in every remote place in my country. So we are preparing programs now just to be able to supervise and to run and to look after these clinics while they are running. This initiative is there. It is prepared, finished, and now we are just giving to sponsors and people just to help us to start working with it. So this is how to implement it. This is how to lead it to have an impact on the society at the end of the day, starting with those in the remote and deprived and less developed areas. That's our thinking regarding the way forward regarding the NCD Academy. That's our role in our region, and we ask others, just to try to do something like that.
Great, thank you. And while I have you there, Professor, in answer to that very first question about the vaccine, the COVID vaccine, do you think that may open up avenues to get across management of NCDs and signposting?
Well, now we are sure that about the relationship between NCDs and COVID-19. We are sure that those with NCDs, when infected, when they contract infection with COVID-19 virus, the prognosis, the outcome will be worse. And there are, the relationship is bidirectional. Actually, we know for granted now, for sure, that the COVID-19 infection is causing deterioration of diabetes, for example, and it leads to new onset diabetes. We are sure about that. There are many cases of new onset diabetes because of the infection with the virus, because the receptors on the beta cells which produce insulin are the gate which the virus utilize to enter the cells. So the virus can enter the beta cells, can intervene with the formation of insulin, so it will lead to deterioration of diabetes as well. So having the issue of the NCD in mind when we are dealing with COVID-19 is very important. We have to put them in the center of the interest right from the start. So yes, vaccination, of course, will be something very good regarding that.
Okay, that's great. Thank you very much indeed. We've just got a time for a couple of more questions. I want to come to Namima. You were talking about corporate philanthropies. How can they strengthen community connection, would you say?
Regarding, sorry?
This is for Nalima.
Okay. Yeah, thanks. So, I think, going back to your previous question about COVID-19, I think this is also true. All of our health workers, I think, have an opportunity, even just in a vaccine administration or in screening of COVID-19. I think they can help address racial and social disparities, just by virtue of kind of the communities that they serve. So, I think that corporate philanthropy can play a role in this by, a variety of ways. And certainly some lessons from the ground that we've had include sort of being visible. So, acting quickly, supporting partners in ways that they need most, being clear and direct with our messaging, and sort of what we want to achieve with our support, being aware of different experiences. So I think this has been true across all of our global partnerships. There's no sort of one size fits all. Staying nimble, I think, with our commitments, and being flexible. We've done this through sort of, pivoting our support and financing, making sure that we continue to remain good community stewards, and I think are really thoughtful about our long-term impact. So if this means that we kind of think about, how we measure outcomes or the quality of our work, I think making sure that this shift, we do it in a very thoughtful way. I think that the corporate philanthropy world has a large role to play.
Thanks for that, Nalima. And I was intrigued in your discussions about the South Minneapolis example with the Somali population, but how are the healthcare, we're talking about strengthening healthcare workers and enabling them to do their jobs. In that project, how are the healthcare workers being helped?
Yeah, it's a good question, actually. I think that this was not something that we, I think in the ways that we intended to support them weren't really fully realized until COVID-19 hit. And so I think it's through a variety of ways, through constant training. I would say mental health support has come to the top of the list. Making sure that actually, we have a variety of partnerships where we look to support health workers and their wellness as well. So if it's, while they're at work, they're getting their checks, that they're getting their blood sugar checked, their blood pressure checked. They have access to counselors if they need them. They're constantly trained. They have all of the resources that they need. It's tough with a lot of these nonprofits and small health centers where I think, they have to downsize their staff, or the staff end up contracting COVID. And so I don't know that we've perfected this by any means. I think what we're trying to do is make sure that, we're listening to our partners and letting them tell us what they need, and then doing our best to try to provide the support in ways that we can. So if it's through PPE, if it's by protecting or supporting health workers, if it's making sure that their health centers are, staffed with the way that they need it, if they need to use funds to hire more people. Trying to be more flexible with the funding. So, I think it's a variety of ways. We're still learning and want to make sure that we share our lessons across as well.
Of course, thank you, Nalima.
Yeah.
Just a last question. You mentioned prevention. I want to come to the issue of prevention to Catherine. Obviously, this is a key element to fighting NCDs. How can we improve patient outcomes through interdisciplinary collaboration and coordination, including community pharmacists in this prevention role?
Thank you so much, Jackie. So one of the things that we know in pharmacy is that very often, because we aren't necessarily integrated into the healthcare system, we're not always counted in amongst the first healthcare professions to be listed. But the pandemic has meant that the community pharmacy network across all of our communities and societies has become really visible and really highlighted that role. And we've seen greater recognition of the role of the community pharmacist by governments, and have pushed for them to be recognised by governments, if that makes sense. Now, the key thing here is that pharmacists shouldn't work in isolation if we're going to maximise the impact that we can have as an interdisciplinary team. So we've been doing an awful lot of discussions with our dental colleagues who hadn't necessarily been allowed to open during the first waves in our different societies, and how lessons could be learnt from both professions, also with general practitioners as well, but also the ways in which community pharmacy can be a point of contact for then subsequent triage across to other professions. And it fits very much with the prevention agenda, the prevention of diseases worsening, the issue around communicable and non-communicable diseases, and how, as has just been outlined, patients who suffer with comorbidities are at greater risk of bad outcomes from COVID and other infections, but also patients with infections can manifest diseases requiring, NCDs, full stop. The ways in which we've learned from this in the Alliance, we're sharing lessons learned. But I think there's a really good opportunity here for us to work across different agencies and learn ways in which we can all play our part and all play an effective role, whether you're based in the community or in hospital settings or in those intermediate care sectors as well. Mm. A final point, Jackie, just to note, is that many of our community pharmacies and pharmacists in those community pharmacies provided a really important link to care homes and nursing homes in the pandemic, which we know have provided additional challenge to how we manage patients with COVID. And I think those lessons need to be taken forward. Once we find our way through this pandemic, there's going to be a lot of valuable lessons that it would be a shame to lose them if we don't make note and take note right now.
Thank you, Catherine. Well, we're coming to the close of our meeting. I want to thank you for those questions from the audience. I just want to do a very short recap to say that obviously we've heard about the tremendous contribution that healthcare workers, and particularly primary health workers and community healthcare workers are making towards NCDs. But however, they've been held back this year by COVID-19, and there's been a number of different issues, not only themselves being at risk, but obviously health systems being disrupted. But obviously it's vital to ensure that their work continues, to make sure that NCDs do not get worse. And we've seen some really exciting opportunities and developments that have been put forward in terms of supporting them, their well-being, their mental well-being, as well as their physical well-being. But also we've heard particularly about the Ncd Academy and about the collaboration between the global actors in healthcare to equip these frontline workers to be educated, to have this expert training wherever they are, all around the world. And I think that sounds like a great way forward. One of our audience has said the Ntd Academy is a fantastic idea during this difficult time for capacity building of healthcare providers, especially nurses. So that's great feedback to hear, and I'm sure the message will be put out loud and clear. I want to say a very big thank you to our panelists, to Catherine Duggan, to Professor Adele Salim, to Dr. Logna Salam, and also to Melina Mehta for joining us. It's fantastic that you've taken the time to actually tell us what you're doing and your viewpoints. Thank you also, of course, to Katie Dane, Chief Executive of the Ntd Alliance, for her opening and for organising the event, and to Beatrice too for collaborating. So thanks very much indeed for coming. A really good event. You can see it on our Ntd Alliance YouTube at a later stage. And I hope that you've enjoyed it. And I wish you a very good afternoon from me, Jackie Thornton.
Thank you.
Thank you.